As a medical director, what I do is basically monitor the clinical outcomes, see that the clinical excellence is followed. We follow all the medical protocols in treating the patients the right way. We follow the hiring pattern. We see which are the new programs coming in the market, what are the new equipment which is coming in, which equipment, if purchased, will increase our scope of an area of work, and how to go about doing it. Newer and newer technologies are getting launched. So we look at the technologies, we see which technology is required for a particular hospital, which we are lacking, and how we can improve our services in that particular area, and then recommend to the management that this particular equipment, if we take, we can improve our services. We are an JCI and NABH accredited hospital, so a lot of accreditation work is involved, a lot of paperwork is involved. We see to it that everything is in order, and that is done on a monthly basis. Well, basically I was practicing as an anesthetist for about 25 years before I got into this administration thing. And while doing my anesthesia, we also were running 2 nursing homes, which belonged to my wife. And I wanted a little bit more of a formal training, because we wanted to expand our business. And to do that, I came across this advertisement from Welingkar for their part-time course for working professionals, which was held on weekends. So I did that in my postgraduate certification program in hospital management from there, and that turned my career completely. I initially thought I will be using only this for betterment of our business, which we were into, but then one thing led to the other, and then finally I'm here. Well, if you see a medical graduate who comes into hospital administration will have 3 kinds of roles. One is the clinical, which is the medical superintendent and medical director role, and one is operations, which is one which will be non-medical operations, which involves your housekeeping, maintenance, and all other infrastructural needs of a hospital. And the third one is, of course, the business part of it, where you look after the P&L of the hospital, look at the business angle of the hospital. So these are the 3 basic roles which a person from a medical background will take. There is never a dull moment in the whole day. There are various crises blowing up all the time. We look into all the medical legal issues which keep on cropping up. We look at the patient complaints. We look at the whenever there is any issue, I have to go there and actually go through the whole case file to see if there has been any lacunae from our part. If they are, then not only to correct the lacunae there, but put in a system in place so that this kind of thing does not happen again. And since we are a chain of hospitals, if we feel that a particular error is a system error which has a rather far-reaching this thing to it, then inform the other hospitals also to make those appropriate changes in their systems. Gives a huge advantage if you are from a medical background, because you understand, if for example in clinical side you have to be from a medical background. You cannot be from a non-medical background from the clinical part of it, which comes where, like how if you want to be a medical director or a medical superintendent, you have to be from a medical background, because you should understand what you are going to monitor. Secondly, the non-medical admin, if you are a medical person and with treatment, with training rather, you will be a better manager. It's not that you can handle laundry better if you are a medical doctor, but you will understand the requirements of a laundry better if you know what the end needs are. You can monitor the CSSD, where we sterilize our equipment. You will understand the end results better if you are from the medical background. And similarly with all other housekeeping and the needs, tomorrow when the patients complain, if you are from a medical background, you will understand the nature of the complaint better. You will understand how to deploy a particular staff in which place, the deployment of staff, the strength of this requirement. You will understand better if you are from a medical background. And at the third part, the business part, if you are a medical doctor, you can understand a business needs of a hospital far better than a non-medical person, though saying that the CEO of this hospital, Mr. Raj Gore, he is not a medical person, but he has been in the healthcare for the last so many years. They need a medical person to give them a guidance on that. The person who's running most of our centers are doctors who have gone from the healthcare, who have, after being in the profession, learning about the profession, have then switched careers and gone into administration. See, basically, I feel a person who has done his MBBS and who is more interested in the business and end of the organization, of the career, and not into the patient treatment as such, they are the ones who will end up taking the administrative route. But I would still suggest that, it's good to have some kind of a clinical experience after doing MBBS before you switch over to a purely an admin practice, because you understand the needs better rather than coming fresh from being a MBBS or a BH, or all the allied pathies, BHMS, BAMS, dentistry, physiotherapy. If you have worked in your department for a couple of years before coming into administration, that stands a little better rather than coming fresh off the college. You need to be a good communicator. You need to be patient, because your patience is always being tested over here by the fellow clinicians and the patients and their relatives, and of course the government authorities. You need to be very patient. You need to be able to hear everything without reacting. You need to take your time and come to a conclusion and be very fair in your decision making. These are the attributes I think are very, very important if you are planning a career in administration. There are various courses. There is a diploma in healthcare administration, there is MBA healthcare administration, there is PGP program, that's the postgraduate certificate program. Then there are postgraduate diplomas, PGDs. All are equally good. There is no such. But we prefer at least as far as possible, we do not take people who have done only a correspondence course. Getting an international exposure is always good, because it brings with you their working culture, their way of looking at things, which are very different from what we are doing. However, doing only a foreign degree without having an Indian background is of not much value to us, because the ground reality in India is very different from the ground reality in the US or the UK, or for Australia, Canada, and New Zealand, where most of the people go for their further training. So it would always be advisable to do your basic administration course in India before going abroad, because once you do that, you always come back with added value. Medical tourism has a huge potential today, and the cost difference in the treatment in India versus all the Western world is huge. Our standards of medicine are at par with the best of the country. In fact, we in our hospital, in this chain of our group, we monitor our clinical outcomes very minutely, and we benchmark it against not Asian standards but against European and American standards. And we see to it that all our outcomes fall within the benchmark set for the international and the American standards. And believe me, the Indian doctors are very, very good, and all our benchmarks are within the international standard. Though keeping that in mind, and now that more and more hospitals are going in for the JCI and the NABH accreditation, the medical tourism market is going to boom, and all the medical tourism companies need a doctor, a person with a background of medicine and having done the course of hospital administration to be at the helm of the services. So there is a huge potential for those candidates in medical tourism too. My coming time is fixed, 9 a.m. Going home is never fixed. It can, but more or less all of us can finish our work by 7 p.m. And the hospital goes on 24 hours. So there are emergencies. Depends on what level of admin you are in. Because currently I am in a situation where I am only called on phone and my advice is taken if required. But there are administrators who are there in the night as well. There are in shifts. We have a manager on duty who remains on call every time, because you never know when you require what. So there is always a manager at night, and it's a 24 hour, because hospital is a 24-hour operation. This is a very delicate balance which the medical head has to follow, because what we do is we see to it that none of the clinical protocols are ever breached. The medical ethics are followed very scrupulously in this institute, and this we have to keep in mind, because as you see, modern medicine has evolved so much that the treatment is becoming more and more expensive day by day. There is a situation of generic drugs versus branded molecules versus branded generics. We have to maintain a balance between the entire lot, because after all, our first job is to cure the patient, and most of the doctors who have been trained are very averse with using generic medicines, because we do not know their efficacy. And it makes a lot of sense for us to then talk to the patient and tell them about it. And then, because there are various brands of medicine available and each brand costs different, and there is, for the patient, he cannot come to a decision which brand is better. So we need to talk to our doctors to see to it that they look into the patient's situation also before going ahead with the treatment. This hospital is known for its heart transplant program, and we have done our hospital in Chennai has done 200 heart transplants. This particular Mulund hospital has done more than 65-70 heart transplants. Each of them is a wow moment when a heart comes and someone who's at the end stage of life gets a fresh lease of life. There are patients who are not affording the whole thing, and the management has been so kind, to offer them very, very lucrative packages which fits their budget. So that has been a wow moment when a very sick patient comes to the hospital and goes home treated and happy. In my 25 years of work as an anesthetist earlier, I always thought anesthesia was highly stressful. Believe me, administration is far, far, far more stressful than the anesthesia I used to give. Because there I was dealing only with one patient at a time, though the life of the patient was in our hand, but it was only one patient and I had full control over what I was doing. Here, I am dealing with thousands of people with various different ways of thinking, and on which I have no control. I have to only manage to see to it that there is some semblance of an order before the chaos reigns. So it's always a very, very stressful situation wherein you are responsible for actions not done by you. The jobs are from the junior most level in administration to the senior level. We will always like to take people with some kind of working experience before they come into the admin field. See, if you have done your MBBS, BHMS, BAMS and have done a couple of years of work as a resident doctor in the hospital before you have come into administration, that is preferred, because then we know that you understand the working of an hospital. Same goes with a dentist, same goes with a physiotherapist, because once you have worked after doing your college, you understand how to deal with patients. What are the problems the patients face? What are the problems the residents face? So as an administrator, you are equally responsible for the staff as well as to the patients. So if you know the problems faced by both, you are more likely to be able to take care of them. So we look at a person, so rather than taking someone who has done his college qualification and has directly gone into an administration, we always prefer to have someone who has worked. This is a very good career path. it may not be very financially lucrative in the beginning, because people who are in the clinical background do get paid more than the administrative side, but as the career grows, it comes on par.